Okay, so we did our presentation on Ignaz Semmelweis, the savior of mothers. So Ignaz Semmelweis was a Hungarian obstetrician who first showed that puerperal fever, also known as childbed fever, was caused by an infection that was introduced into the birth canal from outside and could be prevented by sanitizing the hands of the providers before vaginal exams. So Ignaz Semmelweis graduated as a physician from the University of Vienna in 1844, and then 2 years later, in July of 1846, he was appointed first assistant, which is the equivalent of a chief resident, in the obstetrics department in the first division of the Vienna General Hospital. So the maternal clinic was separated into two divisions that were each led by a professor. The only difference was that the first division was where the medical students were taught, and then in the second division, the midwives were taught. So around this time, childbed fever was an extremely common complication in the maternity wards in Europe, and it was the highest cause of maternal mortality. In the first division of the maternity clinic in Vienna, where Semmelweis was working, the maternal mortality rate fluctuated around 9%, which was 3 times higher than the mortality rate in the second division. So Semmelweis was determined to find the cause of this, so he personally autopsied all of the mothers who had died of childbed fever the previous day before he did his rounds each morning. So in March of 1847, Semmelweis' friend, Professor Jacob Kolechka, who was a forensic pathologist, died after a student accidentally cut his finger during an autopsy. Semmelweis examined Kolechka's autopsy findings, and he noticed that they were exactly the same as his findings in the woman who had died of childbed fever. So he now understood the cause, and he called it cadaveric particles. These particles were introduced into Professor Kolechka's bloodstream by the cut in his finger during the autopsy, in the same way the particles were introduced into the birth canal of mothers from the hands of the physicians who introduced the bacteria into the birth canal during the delivery. And Semmelweis noticed that the doctors and students frequently performed autopsies before doing these deliveries, which increased the risk of infection because at this time they did not wear gloves and they were just washing their hands with water. They weren't using any antibacterial substances.
So while those were very important discoveries to link the disease between the mothers and the assistant, his real most important discovery that we all do today is hand hygiene. And because of this, he's often called the savior of mothers, because when he introduces hand hygiene and hand washing, he lowered the levels of the mortality rates that were carried under residents and physicians to that of midwives. So from 10% down to just about 1% or so. Okay. So again, he discovered that after he observed the differences in mortality rates, he implemented the hand hygiene protocols, and mortality rates went the same way for both. So the impact of hand hygiene is pretty obvious because there's less transmission of infection. Now there's less people dying. So the reduced mortality rates for moms was a really big win for Ignaz Semmelweis. And today, hand hygiene still has a big impact on infection control because it reduces the rates of infection. And this is particularly important today because although we have things like antibiotics, some bacteria are resistant to antibiotics now. So hand hygiene is still the way to go in reducing the chances of you getting an infection and getting sick. And again, hand hygiene is the easiest way to prevent getting sick. Although it was really interesting how Ignaz Semmelweis came to his conclusion by finding the similarities in the cadaveric particles and the mortality rates after introducing hand hygiene, a lot of people in the time actually did not accept that idea. And the reason why is because during his time, a lot of people believed that the role of the doctor was blessed and divine, and that there's no way for them to harm a patient by giving them a disease or an infection. And the common scientific thought around the time as well was something called the theory of miasma. And this meant that things in the air was a cause for diseases. And this denial, or this theory, helped perpetuate the denial because during that time as well, there's actually improvements in ventilation systems, and a lot of people thought it was actually because of that, the improvement in ventilation systems, that caused the decreased rates of mothers in Division 1 instead of Division 2, instead of hand hygiene. So for a long time, although hand hygiene is accepted today, it wasn't quite the same story back then.
And here's a video on the proper steps of hand hygiene. Okay, so those were just the proper steps on how to hand wash. And how that relates to hand washing today is that hand washing has always been important, but it's especially important right now because we're in a pandemic, in the midst of a pandemic. It's very, very important. Most of the times we can't see germs or bacteria on our hands, which there's a little visual at the bottom to show bacteria that were on an unwashed hand versus just a rinsed hand with water versus a fully washed hand. So people with those hands, they took bacteria off of their hands so they couldn't see and then put it on a petri dish and watched it grow. And those were the bacteria that were found on it. Patients frequently touch their eyes, nose, and mouth without realizing it. And these are all entrances for sicknesses to go into. So other ways of keeping yourself safe during COVID are to avoid close contact with others, at least 6 feet in between you and the other person if they're not related to you or you don't live with them. You also should cover your nose and mouth with a mask when within 6 feet of others. So it's good practice to keep your mask on when you're not within 6 feet of others, but it's generally within 6 feet of others you should be wearing your mask, especially when you're talking. Also, always cover your coughs and sneezes. Obviously, the aerosol bacteria will go out into the air. Clean and disinfect the surfaces that you use, especially the surfaces of a sick person. And to monitor your health daily and report any new symptoms to your doctor, or report any new symptoms to the nursing student when she calls you on Thursday for our weekly assessment. But yeah, just let your health provider know any new symptoms, even if they seem mild to you, because in the older population, they may have different symptom presentations than in a younger population. And that is the end. So just stay safe, healthy, stay home, and remember to protect yourself. It not only helps you, but everyone around you.
Wash your hands.
Thank you, everyone.
That was excellent. That was excellent. So just let them know that this recording will be uploaded to the Facebook page.
Yes, the recording will be uploaded to the Facebook page per Pam. So
Rolling
thank
Oaks
you.
Rock.
Wait, stop the recording.